A patient arrived at the emergency room brought in by ambulance. The patient was disoriented and agitated. They showed signs of a stimulant toxidrome. This means their body was reacting poorly to a stimulant drug. The medical team immediately began an assessment to understand the situation. Time was of the essence. The patient's condition was concerning. The medical team needed to act quickly. They started by checking the patient's airway, breathing, and circulation. These are the ABCs of emergency medicine. The team also started an IV line to give the patient fluids and medications. Gathering information about the patient's medical history was crucial. The patient had a history of back pain. They were taking medication for their pain, including chlorzoxazone, a muscle relaxant. The patient admitted to taking more than the prescribed dose of chlorzoxazone. This information was vital for the medical team to understand the potential cause of the patient's current state. Overdose of chlorzoxazone can lead to serious side effects. These include drowsiness, dizziness, and confusion. In severe cases, it can also lead to coma and respiratory failure. The medical team needed to determine the severity of the overdose. The patient's vital signs were concerning. Their heart rate was rapid and their blood pressure was elevated. These findings were consistent with a stimulant toxidrome. Blood tests were ordered to check for the presence of drugs and assess organ function. The laboratory results confirmed the initial suspicion of an overdose. The patient's blood showed high levels of chlorzoxazone. This confirmed that the patient had indeed taken more than the prescribed dose of the muscle relaxant. Treatment for the overdose began immediately. The first step was to stabilize the patient's vital signs. This included monitoring their heart rate and blood pressure closely. The medical team also administered medications to counteract the effects of the chlorzoxazone. Activated charcoal was administered to help absorb the drug from the patient's system. This helps to prevent further absorption of the drug into the bloodstream. The team closely monitored the patient's response to the treatment. After several hours, the patient's condition began to improve. Their heart rate and blood pressure stabilized. Their mental status also improved, and they were less agitated. This was a positive sign that the treatment was working. The patient was still closely monitored, as overdoses can have unpredictable courses. The medical team wanted to ensure the patient continued to improve and did not experience any setbacks. During their review of the patient's medications, the medical team discovered the patient was also taking selegiline. Selegiline is a medication used to treat Parkinson's disease. This discovery was significant. Selegiline, when combined with certain drugs, can lead to serotonin syndrome. Serotonin syndrome is a serious condition that can cause agitation, confusion, and even death. This finding added another layer of complexity to the case. Managing this complex case required a multidisciplinary approach. Doctors, nurses, pharmacists, and social workers all came together. They collaborated to provide the best possible care for the patient. The team worked together to address not only the immediate medical needs, but also to develop a long-term care plan. This plan included medication management and counseling to prevent future overdoses. The patient's journey was far from over. They needed continued care and monitoring to ensure a full recovery. This included regular checkups with their doctor and adjustments to their medication regimen. The patient was also referred to a pain management specialist to explore alternative options for managing their chronic back pain. This referral aimed to reduce their reliance on potentially harmful medications. This case highlighted the importance of patient education and awareness. Patients need to understand the risks associated with taking more than the prescribed dose of medication. They also need to be aware of potential drug interactions. The medical team provided the patient with detailed information about their medications. They emphasized the importance of adhering to the prescribed dosages and seeking medical advice before making any changes. Follow-up care is crucial for patients who have experienced an overdose. It allows healthcare providers to monitor the patient's recovery and make any necessary adjustments to their treatment plan. The patient was encouraged to schedule a follow-up appointment with their primary care physician within a week of being discharged from the hospital. This follow-up ensured continuity of care and addressed any concerns or questions the patient might have had. This case serves as a powerful reminder of the importance of vigilance in healthcare. It highlights the potentially life-threatening consequences of medication overdoses and the importance of early intervention. By working together, healthcare professionals can help prevent similar incidents from occurring in the future and ensure the well-being of their patients. This case serves as a testament to the importance of teamwork, communication, and ongoing patient education in the field of medicine.